My name is Anna Rodney. I am the Executive Director of MOMCares. MOMCares is a program that serves Black mothers in particular in Baltimore City who are navigating a high-risk pregnancy and or a NICU stay after a negative birth outcome. So I'm here as a community member, as a community organizer, and someone who is working with a population that could potentially be highly affected by making a decision around the vaccine, which is why we brought Dr. Lamaya and Dr. Getzoff on to kind of have a larger discussion. Please feel free to put questions, comments in the chat. This is meant to be a conversation and kind of like a mind meld around how we can really attack this issue. So please join us in the chat as we start our conversation. I'm gonna let Dr. Getzoff introduce herself, and then
Awesome. So yeah, I'm Eli Getzoff. I am a pediatric psychologist. I've been in Baltimore for about 17 years. Before that, almost a little bit of everywhere. I talk really fast. At heart, I am a Valley girl from California, so I might say and for sure. It just can't get beaten out of me for whatever reason. So yeah, so I've been in Baltimore area for about 17 years and worked at Mount Washington Pediatric Hospital for the past 16. And I work with a variety of different youth in that capacity. And today, for those that didn't hear when I first got on, I got my second shot. So in 2 weeks, I will be fully vaccinated, so we can certainly speak personally as well.
Wonderful. And we are also joined by Dr. Lamaya. I hope I'm saying that right.
Yeah, no, it's good. It's good. It's Rupali LeMay, and I am no, it's okay. It's okay. I am a social and behavioral scientist. I work at the Johns Hopkins Bloomberg School of Public Health. So I'm faculty in 3 departments there and primarily focus on vaccine hesitancy as my research. And so have been really studying vaccine behaviors for about the last 5 or 6 years. And about the 10 years before that, I was mostly in sub-Saharan Africa working in HIV and AIDS issues. So it's great to be here.
And we have our wonderful Healing City moderators here, Abby and Christian.
Hi, thanks for letting us join.
Of course. So I think to start the conversation, I'm going to go ahead and share my screen. Dr. LeMay, Dr. LeMay was wonderful enough to put together just a couple of points around vaccination as to kind of help us guide the conversation that we're going to have. Again, this is a conversation, so feel free to populate the chat with thoughts, feelings, and emotions. All right.
Great. Anna, do you want me to drive and then I'll just hand it over to—
Sure, we can kind of just popcorn it.
Okay. So I think most folks know at this point, we're very lucky. There's a great tracker that the New York Times has been following along the vaccine development process, but we're at this stage where we now have 2 vaccines that are approved for full use. If we can go to the next slide. The interesting thing that I want to talk about very briefly with the 2 current vaccines that we have on the market. So we have the Pfizer product and we have the Moderna product. With regards to safety as well as efficacy, they're very, very similar products. So they're both mRNA vaccines, and you can see with efficacy, they're very similar with regards to protection, the percentage of protection that it confers, so 95%. And then the only issue really that is different here is really related to the cold chain storage, how they're stored. But essentially, they're very, very similar and interchangeable products is what we currently have on the market. If we go to the next slide. Part of the issue that I have been studying and I have been looking at is which folks are most resistant to getting the vaccine. As you guys can imagine, there are different disparities with regards to who feels comfortable and who doesn't feel comfortable, right? So what you can see here is percent of respondents who expressed hesitancy by demographic group, right? So if we break it down by age, we see that younger groups are more hesitant. If we look at race and ethnicity, Blacks and Hispanic adults are much more hesitant than whites. Republicans are more hesitant, rural residents, and then essential workers are more hesitant. So for those of us that are working in this space, we're spending a lot of time trying to target specific disparities that we're seeing where people have concerns. If we go to the next slide, there's a number of reasons I would say that individuals have concerns, and hesitancy is something that we talk about. And these are usually individuals that either delay a vaccine, refuse a vaccine, or decide to make a decision about a vaccine, but they're very uncertain about that decision, right? Or just like not sure about what they just decided on. So if we go to the next slide, I have a couple of ideas of what we heard sort of pre-COVID. So before COVID, when people would come to me and say, oh my gosh, I don't want to get the flu vaccine, or I don't want to get MMR, it would usually be because of these 4 issues. People would say, I don't feel comfortable with the vaccine ingredients. I don't feel comfortable with the vaccine schedule, meaning how many doses I need to get. There's also this misperception of that there is a link between vaccines and a severe adverse event, such as autism, even though this has been soundly refuted in the evidence. And then also low levels of risk perception, right? So when you're talking to people about you really need a shot that's going to protect you from measles, people will be like, I've never even seen measles, right? So if we go to the next slide, this has shifted slightly, and we've sort of seen some differences now related to COVID. We're getting these arguments that, by having the government recommend this vaccine to get us out of the pandemic, that the government is overreaching. We have also heard this argument that authorities do not know best, that science is just another voice in the room. And that has sort of broken down into 2 things that are really fueling distrust. One is misinformation, which I'm sure many are familiar with. And then 2 is the polarization of attitudes, is that people are really, really sort of diverting and diverging, if you will, with regards to how they feel about vaccines. So if we go to the next slide, maybe I'll hand this one back over to you, Anna. I just wanted to set that scene.
Of course, thank you. And so what we're seeing as community organizers, so when I originally approached the topic, I was really asking one of the organizers of Healing City, who I'm a colleague with, what his organization was doing, because as an organization, we want to honor the community's concerns. We want to acknowledge the history of especially medical experimentation and medical discrimination and racism, especially in Baltimore City. But we also want to make sure that we are providing sound advice that keeps our community safe. And so my question was, what are you doing? And he was like, I don't know. What are you doing? And I said, I don't know. And he said, well, let's have a conversation at Healing City. And so here we are. And so the initial question is, has anybody in the room, has anybody who is working with clients, Dr. Getzoff, maybe, have you had any pushback from community members or patients about the vaccine? And what do you say as far as your response to that?
I mean, it's a great question, because it predates COVID. These conversations that I have as a pediatric psychologist, I'm involved in medical clinics. I work with parents and kids, and kind of one of my main things is adjustment, anxiety, worry, like how people are feeling about things. And just like Dr. LeMay so nicely illustrated in her slides, like I hear all of those things. Well, I've never had the flu. Why would I need the flu shot? It can't possibly be so bad because I've never had it. And it's interesting because personal experience is such a driving force and influencer as to what we do. I didn't have it. And then I spent 3 years every year getting the flu and going to the emergency room and needing fluids. Then I got it, never went back to the emergency room. So for me, it was a super easy, like, cool. I know how not to end up in the emergency room needing fluids when I get the flu. I'll just get, a little yucky for a few days and I'll be kind of good to go. So like, I think it's really interesting. And I'm having these conversations regularly with patients about like, oh, well, when it gets to your age, when it gets to you, are you gonna, what are your questions? Are you interested? We're already prepping some of these conversations with kids, because it kind of fits in with the going back to school conversations that are also happening for kids. And, they're very much attuned, even the young ones, about, well, if it's going to protect my family, if it's going to, less about themselves, but like, oh, I live with my grandmother. So, I want my grandmother to get it. And then when she gets it, then maybe it's not so much of a thing for me. But if, the discussion of hesitancy to go back to school might also reflect on it. And I've had kids who leave their classroom and go into another classroom or don't go to that classroom, but will go remote from like one part of the classroom, even though they're at school, they'll go into another area because their teacher's older and they don't want to accidentally kill their teacher. So there's a, there are a lot of these thoughts and, conversations happening in like group formats, individual formats, and, kind of hearing what they say and then dispelling any misinformation that I can. Sometimes I end up sending them websites later on just to kind of show further evidence and information. And some of the time I'm having the conversation with the parents, but more times than not, I'm having the conversation with the kids to kind of have them thinking about where they might stand when it gets to them or when it gets to their family members.
Right. I think I will also add to that and say, in our community, so we work with families that are in the NICU. We have babies who are highly sensitive medically. Also, oftentimes mom is recovering from her own medical event. And so we're having this discussion. ACOG came out of, initially and said, it's not safe. Do not take we're not recommending the vaccination for pregnant mothers and breastfeeding mothers. And then ACOG later has come out and said, the reaction to COVID is so severe within pregnant people, we think that you should go ahead and get it. And so that makes it really difficult for me to have a conversation and say, well, yeah, that information is a little old. And then the question is, well, what's changed? How do we know what's going on? What would you say to somebody that has that actual valid concern, Dr. LeMay, about how would you address that?
Yeah, it's a great question. And it's one that we're getting a lot. And one thing that I always talk about is I talk about the vaccine trial process and how that went through with regards to a diverse sample of individuals that were in the clinical trial process, that, it went through an independent safety and review board with regards to determining its effectiveness. I try to explain that whole process. I also I try to compare it to other therapeutics. So you think about individuals that might be on something like a high blood pressure medication, right? And the reason that that's recommended to you is because your doctor determined that the benefits outweigh the risks. That is the same type of calculation that's made with regards to this vaccine, right? That 99% of people will have no issues with the vaccine, right? There will be a small subset of the population that might have some sort of a reaction to the vaccine. But again, from a clinical trial perspective, both of these products have been tested in a huge swath of the population, 40,000 in one trial alone and 36,000. So we're not talking a small number of people. And so I usually spend some time kind of talking about the trial development process, how safety and efficacy is independently reviewed. And that again, at this point, because COVID is just ravaging our country, that really getting the vaccine is the benefit of getting the vaccine very much outweighs any sort of minimal risk that might happen as a side effect.
Dr. LeMay, I hear, well, I have allergies and I personally should live in my own little bubble, inside, outside, everything, is trying to kill me, bread, all of it. So, for me, I was able to rationalize for myself. And so I'll talk to families about it. So I'd love to hear your take, is that we have far better treatments and far fewer long-term consequences of anaphylaxis, the worst possible kind of outcome, than actual COVID, because you have to sit there for 15 minutes. So if something adverse is going to happen, you have all the medical people right there.
And that's exactly right. And I think one of the things that we are learning is that we know that if you have any sort of allergy, to talk to your healthcare provider, right, to ensure that there's not a contraindication. Again, for the majority of people, they will not have an issue. For the people that might have an issue, obviously we want to make sure that we're not, we're making an informed decision. We're asking them to think about really weighing the pros and the cons of getting the vaccine and really making a decision there. But, it's interesting to me. I mean, most of the places that I've gone and I've been giving these sort of different types of talks where people just have questions are primarily Black church congregations, where literally every week I hear story after story of, oh, this congregation member died this week from COVID. And so I think part of it is really putting it into context, right? That this is not something that is within a specific target population, right? It's crossing race, it's crossing socioeconomic status, it's crossing class. And so I think it's really important for us to always appeal to that issue as well, that this is now I think most people now know someone that either was been infected or were affected or died That's how bad it is in this country. And so part of it, from our perspective, for those of us that study vaccine safety and science, we're just like, how can we make sure that people have the right information that they need to make the right decision about the vaccine, right? We don't want to be coercive by any sense of it. We just want to make sure that and allow people to know that there is a product, and there's a safe product and an effective product.
Right. I also am going to some conversations that I have with colleagues, with friends, with just people in the community around, well, I'm going to take elderberry. I don't know if anybody has heard this. I'm going to take
I've
elderberry and I'm going to go
seen some, yeah.
outside and I don't need a mask because I'm taking elderberry and I'm drinking fresh pressed juice. Can we talk about like some of the implications of choices like that?
I think that it's, yeah, absolutely. Because I and some things are good to, you should have kind of like a kit, but I'm not sure elderberry is one of them. Elderberry, from what I've heard, and Dr. Lemay, you might be able to talk more about the science of it, kind of helps you have a immune reaction and kind of get it out of your body. So from what I understand, there might be like a cytokine sort of increase with elderberry and maybe contraindicative for COVID in particular. But I would definitely, I don't know if that's like a well studied, but it's things that I've heard that, you want to do like vitamin D. You want to make sure that you have certain things kind of like on board, but I'm not sure elderberry in particular would be, one of those.
Yeah, the recommendation that I usually give is I talk about sort of evidence-based approaches, and currently there is no evidence-based related to efficacy of elderberry, and that's usually the way that I explain it, right? So I think that if people want to take elderberry or vitamin C or vitamin D or zinc, I think that's great. If you think that will help your immune system, that is great. But with regards to COVID, it's not going to have any sort of effect with regards to preventing you from getting COVID. There's no evidence to back up that claim.
And so I guess that goes into my next question around what is our responsibility as community organizations? Do we just say hands off? Are we going to not say anything at all? What is the community organization's role? I heard you talking about the church and being invited by the churches. What is our role in this rollout in Maryland around the vaccination?
Maybe I'll start. Yeah, I think from my perspective, one thing that we have spent a lot of time on is doing outreach with these different groups, because I think that everyone plays a role. Part of it is that public health, and I think individuals that work in sort of the healthcare system have lost some credibility because of what has happened in the last year. So, 10 years ago, you could go to your doctor and your doctor would say, do this, and you'd say, great, I'll do it. That has changed quite a bit because there's a lot of distrust in the healthcare system. Last year has also taught us that, because we have a public health system, there could be a perception that the process was politicized, which is what we're hearing a lot. So people are less likely to trust their doctors. And so to me, we're spending a lot of time equipping other community leaders to be the spokespeople and to make sure that they're giving information that is accurate, that is not misinformation, but that's helping people make a decision. And so it's interesting. I just started a grant where we are equipping church leaders of how to talk about the vaccine and, answer questions about the vaccine so they can be really seen as influencers within their own sort of social networks.
Do you have anything to add, Dr. Gazal?
I think community organizers are community organizers because they want the community to be the healthiest and best they can be. So, from that very basic kind of tenet, I think is important for community organizers to be aware of the science and evidence and data as much as possible to be able to really give informed information to their community. Whether or not the community members follow that or take that might be up for some debate, but really being informed, I think, is a very important tenet for organizers.
Right. I think personally, I feel a slight pressure to be that spokesperson, right? Especially because I have my own feelings and thoughts and apprehensions, and like, is this, when it's my turn, am I going to, do it? Like, should I? And so I don't want to inform my my communication with the community with my own personal deals and politics and such and so forth. But we also want to, again, like you said, want to make sure that that our community is at its best. And we're looking at disparities, and we see disparities even in the amount of vaccinations that are available. We're seeing disparities, right? And so we're still kind of, you know, stuck in kind of the middle, trying to figure out where we fit. But I do agree, Dr. LeMay, about the fact that, like, people aren't talking to doctors. You know, we don't want to talk to doctors. We don't want to talk to nurses or medical staff. We don't believe you. We don't trust you, which is very unfortunate because personally, I came from a space of when I gave birth to, when I was pregnant with my first child, with my son, I was like, I'm going to be the crunchiest mama of all mama. I'm still pretty crunchy, but I'm going to be the crunchiest mama. I'm going to do home birth. I don't need any medical interventions. I don't want any of this. And we went very quickly from that end of the spectrum to my son being on morphine when he came out, and being in the hospital for 6 months, and x-rays and things like that. And so through that experience, I personally realized that while you want to keep interventions at a low, sometimes medical intervention can be life-saving, and there is a middle ground to this. You know, I don't want this to, you know, I kind of need this to stay alive. And so for myself as an organizer and as somebody who's leading a community organization, we have these conversations around, you know, I wanted this for my birth and I didn't, and now I'm sitting here and like there's medications and machines and like what that means and how to reconcile your need to trust in the system that you don't necessarily trust completely, right? So it's a very intricate conversation that I think we're all still figuring out as far as, and I think for me as an organizer, it becomes the access to up-to-date, scientifically sound information is really what is the decider as far as what is shared and what's not.
Yeah, I think that's difficult at times because, you know, like I have grand rounds I can attend or go to and kind of get like the latest like vaccine information, which might help inform my decision, where organizers may or may not have as much of that access, and it might come out from other sources that might be, you know, less trustworthy. And I think the good organizers like you are going to be grappling with that, like, ooh, I don't want to inflict my bias, but this is what I'm thinking, but that may not be helpful to the person I'm working with, right? So just like the going back to school kind of discussion where, you know, I had these conversations, you know, daily with kids and with parents about, are you going to, are you not going to? And, you know, as the person kind of being the sounding board and having them kind of work through some of that, it can be challenging because I do have my own kids and my own set of opinions that may be very different than theirs. And as long as their information, their knowledge is correct, then I back off on like what I would do or what my advice is for, you know, unless there's like critical missteps or misinformation that they're not accounting for, you know, allowing them to make a very, you know, might be a very different decision than what I would do. It's not an easy position to be in as an organizer.
Right. So I guess that kind of seeps into the third question around Baltimore's history. Like, let's talk about the history of medical experimentation and racist practices. Let's first of all kind of name that and talk about that a little bit, and then figure out how we can navigate that history in our response to the vaccine. Does anybody want to take that? Go ahead. No.
I can start very briefly here. So as someone that, you know, I did my dissertation on HIV and AIDS, and I lived abroad, and then I started working with Baltimore communities. I think that, you know, there is a long history of distrust because of discrimination as well as stigma related to a number of these things. Of course, those of us that, you know, go through and work in public health, we have to talk about medical ethics, and we hear about sort of the terrible and sort of atrocious atrocities, I would say, that have really occurred, particularly on the backs of people of color. And so I think Baltimore is no, it's really challenging a lot of times to work in Baltimore because there is such a high level of distrust. And I get it. I get why there's a high level of distrust, right? So I'm working with primarily those that have HIV and AIDS. They might be positive. They might be injecting drug users. They might be sex workers, you know, so they're in all of these groups that are very stigmatized and marginalized. And then on top of that, they're also people of color. And so I think there's automatically this huge distrust because of what has happened over the years with regards to the interactions between police and these populations, as well as how the city has not really made, I think, structural changes to make sure that these populations are able to access care in a way that's not stigmatizing or discriminatory. And so, you know, I can very much look at it from sort of a HIV and AIDS lens, as well as more of a now starting to be a vaccine lens. But it is a huge challenge of how do you overcome and build that trust again.
Right. And I would also say, just kind of thinking just off the top of my head around certain instances where that have been publicized, that have been turned into books or movies that are very explicit in the fact
Marietta
that
Lacks. Yeah.
like that are very explicit in telling the story of medical and innovation happening as on the backs of Black folks, and Black people being that place to explore and experiment for the rest of the population. Even when you start talking about the father of gynecology and what that did, and that how that kind of opened up the doorway to the things that we're seeing now. But that was, you know, Black women, Black slaves were used to practice the cesarean sections and things like that, where, you know, like as a Black woman, like knowing that information, like I'm like, oh, like there's a ancestral chromosomal trauma link in my body around medical intervention that is already there. And so I find it hard as an African American, as a Black woman, to say, I hear all that, I know it for sure. Forget that we need this vaccination. And like, again, I'm in a household where we have a number of people who are medically sensitive. And so it's like, I don't, you know, like there are definitely pros and cons to the vaccination for me, but having a real informed conversation, sometimes it feels a little disingenuous to be able to have those conversations. The chat.
Yeah, absolutely. And cognitive dissonance, I think, has been such a critical major player. And so cognitive dissonance, just to kind of get to my little psych baseline, is when we kind of convince ourselves of something other than where maybe the facts lie because we have to get through. So something that happened with my work was difficulty. Psychology, we talk for a living. It doesn't really matter where we are. So psychology was able to mobilize and be remote really quickly. And medicine, typically they need to see and touch and, you know, feel their patients. They weren't able to be remote in that same way. And there became this tension within our hospital because the physicians were like, well, why isn't psychology here? We're here. Why aren't you guys here? It's safe. I'm not getting sick. So why do you think you're going to get sick? And that it was, you know, again, somewhat of a cognitive dissonance, like, well, maybe you're not getting sick because like a quarter of the staff are actually on site, right? Like the cafeteria isn't busy, you know, the check-in center isn't going to be overpopulated. The waiting room is not going to be as busy as it otherwise would be. It's just for the medical clinics rather than all the other services that can be remote. And so this cognitive dissonance can be really interesting and get played out in a lot of different ways, and particularly around, you know, where to go, what's safe, and, you know, vaccine or no vaccine. So I think that's an amazing point, Alexis. And if you want to add a little bit more, that would be awesome.
Right. I think, well, that leads me to a question where we were looking at the numbers that were in the slides previous around those who are adverse to it. And seeing the people that are frontline defense who are in the medical setting have the highest degree of aversion to the vaccination. Do we know, is that part of the reason why? Like, do we know where that's coming from? I would assume that if I was in the hospital, I'd be running to get it.
Yeah, we're seeing about 25% of our healthcare workers that have been offered here at Hopkins have declined the vaccine. And a lot of that has to do with, we don't want to be guinea pigs, is what we're hearing. We're also hearing concerns about sort of the very fast development process. And so that's another concern. And so it has caused a huge challenge, as you can imagine, because we're really hoping that our healthcare workers would be front and center getting this vaccine. They're the ones that are being exposed at much higher levels. And yet, we're still seeing hesitancy. And so there's been a lot of work in terms of outreach, of working with healthcare providers. What do we need to do to really, assure confidence, if you will, in the vaccine? And I'm so sorry, I am really running on 4 different deadlines today. And so I have to jump off. I so apologize, but it was great to connect with you all. And I'm so sorry, Anna.
Thank you so much for joining us and giving us your perspective. Good luck. I definitely understand.
Thank you. Okay, bye.
Bye.
Yeah, I think it is interesting. I went, like I said, for my second shot today, and my entire psychology department was there. The minute they opened to psychology, we weren't part of the first round of people within our hospital to be eligible for it. They went for the on-staff physicians, environmental services, cafeteria security, those people that actually have to interact on campus. But in the round where psychology, I guess a majority of us went the first couple of days, and then we were all supposed to get it on Monday, but with the snow, it was amazing. Like, I haven't seen these people for like 10 months, and they're, like, we're, 20 of us at a particular time just waiting in line to get our shot because we were so excited to have the opportunity. But I think it's like 68% at our hospital are getting the vaccine. And so that's 32% that haven't or chose not to yet. And they don't have a breakdown as to what disciplines those are, as to if those are more physicians or frontline staff, or more ancillary staff, or people who are doing medical records or something like that. That information I don't totally know.
Well, to me, that kind of is a counter narrative to what I've heard as far as a reason to get it, because I've heard, well, medical staff, they see the atrocities, they are in there seeing what can happen, and so then the question becomes, well, if these folks that are in the hospital that are seeing what could happen, if they're not getting it,
and that's the beauty and the danger of cognitive dissonance, right? Because they might have this like superhero sort of like, well, I've been doing this for 10 months and I've not gotten it, right? Like, they might inappropriately feel as though they're somehow special or protected. My mom, who's upstairs, so I'll talk a little softer so she doesn't hear me. She's a nurse. So when this all first came down, she was like, well, I'm immune to everything because I've been around everything. I've been a nurse for 50 years. So like, I don't need to worry. And this is going to sound terrible. Thankfully, she broke her arm and she couldn't go anywhere for like the first 8 weeks of the pandemic, which is great because then she got to see, oh, this is like serious. And oh, I probably am not. I am a 75-year-old woman. I'm probably not immune, even though I've been a nurse forever. But these, misinformation and misbeliefs, like, those things can happen everywhere. We can all have our biases that are inappropriately attached to situations. And that's essentially what we're fighting against as much as the actual illness.
And I'll also say, as far as cognitive dissonance, being a hippie, me being a hippie in the yoga and meditation and positive affirmations, I have a lot of colleagues and friends who are also like, well, I don't believe that I'm going to get it, so I'm not going to get it. Right. I'm not going to get, COVID because that's not a part of my reality. And again, as a student of like positive thinking, I totally understand but also understanding that there are certain tools that can help you safeguard yourself, right? And so I know people that are still planning on taking trips, and I'm like, what is going on? Like, what are you doing? Are you going to get the vaccine? No, I'm not getting the vaccine. No, I'm not going to quarantine when I get back home. Like, I'm just going to get on a plane. And it's like,
and
hey, Anna,
the
can
vaccine.
I say something right here?
Oh, I'm sorry.
Hey, this Coop.
Hey, how you
Hi.
doing, Coop?
Hey, how you?
Good.
So I'm listening to the conversation, and I'm kind of on the border where I want to get it, but my most precedented thought is not to get it. Right. So for an example, I've never was a person that really got too much ill or sickness as I was younger. Right. And I remember one time, it was around what one of the diseases came out where they said you have to take the flu shot so you don't get whatever the disease is that was out at the time, right?
Mhm.
I can't remember which one it was. Like I've never got the flu shot before this, but this particular time it was, oh, this virus is here and it's taking everybody out, da 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 da, similar to what the COVID is.
Mhm.
And they said everybody need to take the flu shot. So I went and got the flu shot. That year that I got that flu shot was the first time that I got sick and I actually had the flu. Like the entire time, I was
Mhm.
completely sick for like 2 weeks off of getting that shot. And I've after that one time, I've never taken the flu shot ever again since. That was many years ago. So now that we're here and we're talking about the COVID, I want to get the vaccine, but based off of what my thought process has been before this, like to not get it because of the track record that I've had with illness and those things like that. Like I'm to the point now where it's like I don't want to take it. I'd rather be in a space where I safeguard myself. Like since COVID has started, I've barely been outside around different people. I've barely been in too many situations without the proper precautions that people are saying to take. So
Mhm. Mhm.
I'm kind of interested to see what you guys take is on
Yeah.
that thought process and that mentality, because I know there's a lot of people that's like that. But my main sense is that I don't want to take it because I don't want to get sick.
I think,
It could that it's in me. Thank you, because that's really, really important because I think that is what a lot of people are thinking. And I know at one point in time there were people that would get not the flu from the flu shot, but they, there are a couple and it goes back to cognitive dissonance, right? Like, oh, I got the flu vaccine. I don't have to be careful anymore. Like it's okay because I'm somehow in a, protected barrier where it's not gonna, hurt me. And these vaccines are a little bit different than some of the other vaccines like measles or whatever. You can still get it. You're just not going to die from it. And so for me, I I don't want to go out this way, right? So for me, it was important that I had, I might still get it, and I might get sick. It might knock me on the tuchus, but I'm not going to die from it. I'm not going to get the severe, severe version of it. And so I still need to be protected. I still need to be careful. I still need to wear my mask and sanitize my hands and not go to foolish sort of places where, I might increase my chances. And I think it's a slightly different thought process. So I know going into it and after my first shot, and I got the Moderna type, and I know the different shots do things a little different. So I had a sore arm, like, someone had punched me in the arm or, a little bit more than a flu shot, but it was gone in about a day and a half. It wasn't that big of a deal. I think it was like maybe two sleeps when I felt it when I rolled over on my arm. And, I knew that I was going to have that level of imposition or annoyance. After the second one, it worked out well that I got it today because it's Friday and there's, if I need to be, more couch bound tomorrow, I can be. But I know that there's, if I have a reaction, that means that my immune system's being triggered to respond and build the antibodies, which I really, really want to have. And I think personal experience of knowing someone who has had a really bad course of it can be helpful. And as healthy as you are, you're only as healthy as you are now, right? So there are a ton of people who have had really great immune systems and haven't gotten sick historically, but this is brand new. So we don't have any baseline or historical antibodies or immunity like we might with other things that have been around for a longer time period. And I've heard like on like news reports or whatever, someone being like, I didn't think I would get it. I didn't think I was a high risk target. I didn't think, and they end up in the hospital. What we do know from the facts are there are people with certain conditions, certain ages that don't do well with it. But that doesn't mean that you have to be in one of those demographics to not do well. I so I work at a pediatric hospital, kids who largely, people are saying kids don't get it. Kids don't get a weaker case of it. Like largely is very different than none. And I maybe have only seen a handful of kids who haven't done well, but I don't want it to be one of my kids that don't do well. Because what's interesting is like you can worry about yourself, but also others. And so I want to make sure that if like my kids get it and they bring it home, they don't have to deal with the guilt of like almost killing me. I'll get sick, but I won't get as sick, right? I know that they largely, if you go with the stats, won't get super sick. But like I said, I have seen some kids that really are not doing well and have extended stays. We had one kid who's literally been hospitalized since August because she had such a bad go with COVID.
Yeah, and I thank you, Coop. This is what I wanted. I want this conversation. But so I understand you. So number one, and I'm trying really hard not to bring my own thoughts about it into the conversation, but I know exactly what you're talking about. And it's kind of like, no, I don't need it. I don't want it. Like if it's gonna make me sick, if I haven't been sick, if it's gonna make me sick, then why would I put myself through that? And again, that goes back to this apprehension that, you know, especially in the Black community, is like, we've been tested on, like we've been the test dummies for this stuff for forever. So I don't trust you in the first place. And then the one time that I do say, okay, let me go do it, I have this adverse reaction. I won't talk about me personally, but when my son was born, they said, oh, he needs the RSV vaccination. RSV is a respiratory infection. And so I went back and forth because I had questions about vaccinations, period. And then finally they're like, if he doesn't get it and he gets it, he's gonna die. And of course, that's the favorite thing to do, is like, you're gonna die or your baby's gonna die if you don't do this. And so of course I was like, okay, give us the vaccination. But it was something that needed to happen over a course of years. And so the next year when I went into the doctors, and I was like, okay, we need our RSV vaccination. Oh, you don't qualify for it anymore. And so now we have this unfinished course of vaccination, which isn't really a vaccination. I came to find out later. It's something different, for that my son is now possibly at higher risk because he's got these things, you know, in his body that he didn't have before. And so I again think that that's what makes advocating or having any like concrete conversation or position as a community organizer makes it difficult for me. As far as I don't know. I don't know if I should be like, hey, everybody needs to take it that it's available for. And then also understanding that it's not available. You know, it's not available to everybody. We're in like the single digits. Charlotte, I see your hand. We're in the single digits as far as actual volume of vaccination that's available in Baltimore City. And so it really becomes this balancing act